Good morning, colleagues. Thank you very much, Leslie. And I'm going to pick up some of the themes that Leslie's been talking about. But what I wanted to do this morning was to share with you the approach that's been developing over more than 12 years in Perth and Kinross as we've worked towards integration. And within that, to pick up 2 or 3 areas, one around data, one around locality engagement, and one around culture. And preparing for this presentation this morning, I just realised how long we've been working on integration in Perth and Kinross, and at least for 12 years. And during that period of time, we have received tremendous support from colleagues, particularly from Scottish Government. And I was thinking that we've had one constant support for all that time, and it's Kathleen Bessos, and I'd want to thank Kathleen for all the work that she's done over the years in Perth and Kinross and helped us bring us to where we're at the moment. So thank you very much, Kathleen. Let me just explain very quickly the framework, if I can. And right at the centre of this circle, you will see that there's a specific focus on the person, not the patient, and not the service user. And I absolutely would accept that language is important at an organisational and operational level in terms of having a common language to inform our practice. But what we keep trying to challenge ourselves is to remind ourselves that there's a person here and their needs, their family, their community circumstances are actually important consideration in terms of the decisions that we make. We've also over the years worked at developing our strategic and operational leadership and importantly working to develop our practice around integration. Some have worked, some has not, and when it's not, we've taken stock and we've thought about how we would do things differently. We've also worked hard over the years, as Leslie has just picked up, in working with people, with their families, with carers, but also with communities themselves, and more to do on that going forward. We've also been very careful to try and protect the services within communities that matter. Yes, different way of delivering those services and getting better use of the public pound, but nevertheless protecting them, but also investing in community-led provision, of which time banking in Perth and Kinross is a great example of communities providing care services for other people within the communities, and a great example of going forward how we have to work with communities to deliver services as opposed to for them. But what I wanted to pick up specifically by way of 2 examples is our work in terms of the use of data to inform our decision making, and we believe that in these challenging financial times it's even more important that we understand need, we understand the impact of decisions that we're making, and we understand what works. And I also want to say something about how we're using that data to inform locality planning, decision making, and also engagement. But let me start. I have 2 slides with data. Okay, the Scottish Government are promoting a new indicator which is around where people spent last night in the plus 65 age group. And we like that indicator. We think it helps us to understand a measure of how much progress we're making to people living within their communities. So at a macro level, it is a really helpful indicator. However, below that, it's understanding locality variation. So at the meso level, if I can explain this to you, Perth City North, something's happening in Perth City North. It has the highest percentage of over 65s in hospital. It has the highest percentage of over 65s in care homes, and it has the lowest percentage of plus 65s in terms of that indicator staying at home. But then below that, at the micro level, it is about understanding variation across GP practices. And I know it may be difficult for you to see, but I'm sure the slides will be made available. So let me give you a contrast between 2 practices in terms of unplanned admissions per 1,000 of the practice population. And the highest is Taymount Surgery at 77, and the lowest is the Rowans at 10 per 1,000. So we're using the data to understand or try to understand the variations and why that would occur. In Perth City, there's more care homes and there's also an acute hospital. But I don't make any comment about that because it's genuinely about using the data to inform future decisions. And again, if I look at locality consumption, and this is the totality of health and social care services within particular localities, again, something's happening in North Perth City with the highest per capita spend in over 65s, but also in terms of the total consumption of health and social care services. So, what is the point of gathering the data if we don't use it? Well, we have been. And we've used the data to inform clinical and professional discussions around consumption, around understanding variation and understanding what we need to do differently. So, for example, a rapid response team emerged from that thinking, that discussion, around the ability to provide home care services on the day based on nursing advice, and for that to help with reduction in unplanned admissions and also lost bed days as a consequence of delayed discharge. But we're also using this data to inform redesign at locality level and also in a way of engaging communities in a different discussion about the future design and delivery of services. Aberfeldy was mentioned by Leslie. Aberfeldy Community Hospital, more than 100 years old, and we also have a residential care home, Dalhousie, which was built in the 80s for a different period of time. And neither of these facilities are operating at optimum capacity. So therefore, we needed to do something differently in terms of planning for the future of health and social care needs. And we've undertaken a tremendous exercise, in my view, of engaging the community, facilitated by voluntary sector organisations and our community development staff. And where we're getting to with those conversations is the likelihood of the community hospital being closed, medical beds being provided in the residential home with some investment there, GPs providing services that previously, some of which had been provided within the community hospital, but most importantly, this has not been designed by the two statutory organisations. This has been informed by the community themselves in these various conversations that have been held over a period of time. And not only are they designing the services for now, but they're looking to future-proof these services. And I guess that will change over time, but it's a model that's worked for us. So, if I may just finish in terms of looking at how we need to use our staff. Because it's been talked about this morning that it's people who make a difference, it's people who design services, it's people who deliver services. And that is why a lot of our investment in terms of that process of integration has been organisational development, investment, and working with our staff. I know Perth and Kinross Council social work staff, and I also know many of the staff in managerial and operational responsibilities in terms of health in Perth and many of the voluntary sector organisations. And I've never met a member of staff who's not absolutely committed to doing their very best in providing care and support for people. And that is why we've invested so much of our time in working with our staff. Because if we're creating the right conditions, the right cultural conditions, which will ensure that staff are part of the vision, they're part of the planning, that we're boosting their confidence, that we're creating the kind of authorising environment, so staff in Aberfeldy, Pitlochry, or anywhere else are able to work with communities and make decisions that are relevant for those communities. If we could create those cultural conditions, and that's been very much our focus, cultural conditions, support staff, will deliver the kind of integrated partnership working and ultimately the outcomes for people that we're committed to delivering. And in Perth and Kinross, we have a challenge which has almost become our mantra now, and it's this: if not me, who? If not now, when? Thank you very much.